Here in ESMO in Paris, we are presenting results from a translational research project of the ALTTO trial. The ALTTO trial was an adjuvant study in HER2-positive breast cancer, testing the effect of adding lapatinib to trastuzumab in this setting. The trial was negative from a statistical point of view, and here for this analysis we performed an analysis only on the trastuzumab arm of this trial. That is the backbone for many other anti-HER2 treatments in the adjuvant and neoadjuvant setting. So our results were based on a case control cohort, so it was a cohort matched for clinical pathological characteristics, and it was based on the RNA sequencing data that we collected on this cohort of 386 patients. So we started with a supervised approach. We started to identify the features that were associated with prognosis, and then we performed some categorization and classification methods to integrating also intrinsic subtypes to identify 5 HER2-positive breast cancer subgroups. So these were characterized by interesting features because one group of HER2-positive breast cancer was clearly immune-enriched. There were other 2 groups with worse prognosis that were proliferative and metabolic enriched, and metabolism is becoming more and more interesting in HER2-positive breast cancer also as a potential target. One group was mesenchymal stroma enriched, and here it's very challenging because it's a group that it could be difficult to target because there are lot of trials trying also in other tumor types to disrupt the extracellular matrix and to try to avoid the effect of stroma. But the characteristics of these groups were interesting because it was also mesenchymal from a certain point of view, and probably also with some levels of stemness in the tumor cells. And then finally, last 2 groups that were the luminal tumors, mainly characterized by estrogen signaling, and the HER2-enriched tumors, mainly characterized by HER2 signaling. And these groups were relevant from a prognostic point of view because immune-enriched and luminal tumors were the groups with the best outcome compared to the others, in particular the proliferative and metabolic enriched and mesenchymal stroma enriched with the worst prognosis overall. So we highlight further the heterogeneity of HER2-positive breast cancer. We further support also the idea of trying to de-escalate treatment in luminal tumors and immune-enriched tumors. That has been something that we try to do, but still we need more data in order to really implement this strategy in the treatment of the patients. And then, of course, we will need further validation, and in particular, we would like to try to test the effect of these groups in the neoadjuvant setting, so in patients that will receive neoadjuvant before surgery and then continue the anti-HER2 treatment. Because this population in particular was very high risk, and this is a population that now would receive mainly neoadjuvant treatment. So that's interesting to translate these groups in the neoadjuvant setting.